So first of all, just a clarification, the 76,000 doses, is that for 76,000 people, or is that 2 doses that each person needs? So we're talking about 38,000 people that will get vaccinated out of the get-go.
Correct, the latter. It is the latter, and you're absolutely right. I will be myself at University Hospital in Newark tomorrow morning as we kick things off. And then these are the Pfizer vaccines, and Albert Bourla has been a great leader, including in many deliberations with us in New Jersey. Each week we'll get an increased allotment up until it reaches a plateau early year. We'll get, hopefully, Moderna getting their authorization this week and another series of deliveries over time from them.
I guess my question would be, how many people qualify in this first basket of people? How many frontline workers do we have, healthcare workers, and then elderly people who are living in nursing homes?
Yeah, many hundreds of thousands. So my guess is that this is, you're into significantly into January before you're able to get to all of these folks. And you're going to have overlapping waves of some folks in the process waiting for their second jab, while others are then at the same time getting their first. Logistically, it's not as you can imagine, this is complicated. But it's really good news, and it's, I hope, the beginning, I'll paraphrase Churchill, the beginning of the end.
Yeah, let's hope. I'll second that. Obviously, there are going to be some issues trying to figure out how we distribute this, where the difficulties are along that line, and then deciding who gets it next. How do you tackle those things? What's your biggest concern about potential trouble spots in terms of just getting this out?
Yeah, so we're still in the thick of things, Becky. I mean, I should say that up front. This is really good news, but I think the next 6-8 weeks are going to be really tough in New Jersey and in our country. There's a lot of fatigue, a lot of private spread, a lot of holidays, cold weather, all of that's conspiring. So the near term, I would just beg with people to do the right things and to keep their guard up. And you're right, the first group, healthcare workers, long-term care residents and staff, is a defined amount. Again, not logistically easy, but we see the road, the path to get them all vaccinated. The next group, the so-called 1B group, is a much larger group, and a lot of folks with a very good case as to why they should be up to bat next. Essential workers, educators, longshoremen, first responders, you name it. And so that is still something, that is still a work in progress, I think, both in New Jersey and around the country, and trying to get that balance right between supply and demand in that next group will be the next challenge.
Andrew?
Governor, I just wanted to pivot, if I could, to get your thoughts on the decision by your neighboring state, or at least city, the governor of New York, effectively shuttering indoor dining in New York City, and curious how you're thinking about that decision, especially in relation to your own state.
Yeah, listen, we haven't had a better partner than Governor Cuomo. The neighborhood has been coordinating intensively from moment one, and we still do. But that doesn't mean that we take exactly the same moves in lockstep. We were one of the last states to actually get to indoor dining. We never got above 25%. And I think, Andrew, it's one thing to say you take on more risk, and folks know that when they do something indoors, particularly where you have to take your mask off, versus another that we know explicitly in restaurant X or Y, we have transmissions and we need to take action. So we have so far, and I think we'll continue to, for the time being, be using the scalpel, strategic steps. So, for instance, we stopped indoor dining at 10 o'clock at night because a lot of restaurants, or some restaurants, were morphing into more of a club atmosphere, letting their hair down, if you will. I think we'll stay where we are, but again, all options have to remain on the table.
Shepard Smith here. Thanks for watching CNBC on YouTube.